Why might you not even need a neurologist for dementia? If you're new here, I'm Kelly. I'm a dementia nurse navigator, and I help families navigate the dementia process. So, a lot of dementia diagnoses do not even really require a neurologist. Maybe you've just gotten a diagnosis, and your primary care gives you a referral to neurology. You call up, they've got a 6-month wait list, and their appointments are only 15 minutes. And you're really frustrated. Neurology is great. They're brilliant. They're fantastic at managing some of the more difficult things like Lewy body dementia or even Parkinson's dementia. But their offices are usually full, long wait lists, and quick appointments. They don't help you as much managing the day-to-day things. If you have a whole lot of behavioral symptoms, you might be better off looking for a geriatric psychiatrist or a geriatrician. If a geriatrician or a primary care provider who has a really strong experience in senior care dementia is going to be a better bet to help you manage your day-to-day. They can also a lot of times connect you to geriatric care managers who can again support that day-to-day, those questions, the concerns, the behaviors, help you track things, help you figure out what's going on. Neurology does a great job. They're not going to be dealing as much with the mood and the behaviors if that's what you're struggling with dementia. It might be better to put your time, if you're having to pick and choose doctors who you're going to see if your loved one gets really overwhelmed, you might want to prioritize like geriatric psych or a geriatrician. You also want to think about if they're further along in the process, you're doing more palliative care, a neurology appointment might be something to drop off if your primary care physician and your geriatric psych feels comfortable managing a lot of those meds. It's just a way to streamline the process and move things down. While neurology is great, it's not the be-all end-all for dementia. They don't always provide that support that day-to-day and managing those symptoms. Sometimes there's other specialists that even they will refer to. So knowing that up front, you can ask your doctor, you can ask your primary care if they have a recommendation for geriatric psych, if they have a recommendation for a geriatrician, who's going to be best to manage dementia instead of just your neurologist in town. They might be better for the movement disorders or more neurological specific behaviors rather than just dementia related behaviors.